Cheryl. Thank you so much for being with me today.
It is my utmost pleasure. Thanks for having me, Nurse Rosa.
You are an expert in AI as a nurse, and you work with PointClickCare, right?
I do. Yes, I'm principal product lead in their AI platform space.
That is amazing. I know you have your hands in so many different things, but what innovations would you say are making the most impact on nurses today?
Nurses today are really challenged by this mass amount of data that we're so lucky to have with the digitization of process, but also that data is just drowning nurses. There's really, really plenty of data. So I'm so excited about the innovations that I'm seeing for nurses that help to aggregate that data, find some trends in it, and then surface it up within that nurse's clinical workflow to augment that decision that they're going to make. Instead of spending 10 minutes looking for the last 10 results of something, AI and innovation can help us to bring that information right into that nurse's workflow. And that's really essential for nurses today who are, we're caring for a lot of people. People are very ill. The amount of transitions are high and fast. And so nurses are really facing a lot of cognitive overload that impacts the nurse's well-being and the
Mhm.
nurse's wellness. And so I'm excited for the innovations that are impacting those two things, both AI and clinical decision making, but also AI that, helps to take care of the nurse and the well-being of our nurses. And I actually think you're going to see, innovations in both directions because, hospitals and administrations, they've really realized that if they don't have a healthy workforce, they don't have a healthy business. Those two things go hand in hand. So I'm excited to see that impact on nursing.
Yeah, that sounds like a beautiful transition.
Yeah.
And what trends do you hope are talked about at Health this October?
So, first and foremost for me, and something I'm very passionate about, is the idea of responsible artificial intelligence and how nurses who are the workforce that are going to use artificial intelligence, it's just a tool. It has to be in the hands of the nurse. And so I'm excited to see at Health how we bridge the gap between a nurse who's going to use a tool. We are transparent about that tool's strengths and weaknesses. When would you use this? When wouldn't you use this tool? Because with that transparency that for me, it comes under this cloak of responsible artificial intelligence, understanding the model, understanding what it can do, what it can't do, what is it good at, what population was it trained on, and what population should it be used in serving. When we see that transparency, you gain the trust of the nurse, the trust of the user. Like the last time you used a power tool, Rosa, you have to trust it. You have to know its capacity. You have to know what it can do and what it can't do. And so I think this is a really important year to talk about RAI, responsible AI, and to teach nurses what questions to ask. How do you break apart a model? How do you know if it's worthy of your population or a clinical trial in your hospital, in your nursing home, in your sector? I'm excited for that, that trend and that conversation because with that transparency, we do get buy-in and trust. And man, when you turn nurses on to a really impactful tool, it'll sweep. And that makes a huge difference in the quality of care and the outcomes of care. And that has always been what drives a nurse. She just wants you to get better, feel well, and go home.
That's true. And is your organization, Point Click Care, announcing any exciting news at Health that will have a positive impact on nursing?
We have some really exciting news, and actually, it's an area that's very passionate for me. I started working as a nurse in skilled nursing spaces where we would sometimes have to send a skilled nursing patient back to an emergency room if they presented clinically in a way that we didn't understand. When we take someone into a skilled facility, we know why they're there and we can anticipate that treatment plan. And when they present different from that, and maybe they need a diagnostic, a test we don't have, or a specialist that won't come to the nursing home, we have to send that person to the hospital for those tests for those people. Very personal. It's all I happened to do it yesterday with my own dad. So these transfers, like the why are you here? And reason for transfer is actually a really exciting model that we've already introduced into the market. I think it'll be talked a lot about at Health, where we're using some of this artificial intelligence to essentially look through the last day of notes and what's been happening with that human and package up a summary that an emergency room team can quickly open and say, why is Cheryl here? Here's a summary of what's been going on in the last day. And answering that question really rapidly, it really matters, right? It helps with triage, it helps with getting the right priority of that human. And that's a fundamental component of care collaboration. When we as a continuum of care utilize each other's buildings for the right reason. I'm not saying the person has to be admitted, but I'm sending them to you because, frankly, we don't have that machine and we don't have that specialist. And we'd like you to rule this out, have someone give us their opinion, and then send them back to us. Like, thank you for providing us the service that your building can do, and then send them back to us, and we'll continue from there, assuming that whatever that diagnosis and the trajectory of that care is within the care competency of the skilled nursing facility. So that coordination and the collaboration, when we do that well, efficiently, we reduce costs to the whole system. And with so many providers entering into contracts that share both upside and downside of a contract, we have to look for innovative ways for technology to get that right information really efficiently, again, into the hands of that clinician. So our reason for transfer will help with our emergency department optimization, and again, help to use it for what it's good at, and then send the person back to that part of the continuum where their care needs are in fact going to be met.
Excellent. That is gonna be really exciting to hear about, especially since it's already been rolled out and to hear about that real world application. So, thank you so much for coming on and sharing with us the exciting ways that AI is helping nurses and what we can hear about at Health.
Absolutely. And it's changing so rapidly and so quick that I hope that your listeners will tune back into some future episode, because as soon as this one's over, we'll have to do another one because there's so much exciting innovation coming this way.
Yep, it's nonstop. Thanks.